I want to read you some of the letters that have come in. Glenn, across the street from me lives a man and his wife. Gary is a Vietnam vet who refuses to take food stamps. His wife, Michaela, has a very delicate health issue, and she has spent some major time with heart surgeries. Wonderful people who have had very hard times in the last few years. Healthcare takes up already a third of their income, and their income is meager. Neighbors have noticed in Plano, Texas, that they collect aluminum cans while they're out walking at night, so we've all pulled together. And there's often a bag of cans left on their porch, for which they're very grateful. Good people. They have almost nothing in the way of this earth's goods, but they have everything that matters. As of October 1st, their health insurance premium, their deductible, and their cost of filling prescriptions were bumped up because of affordable health care plans. This has been bumped up to the point that Gary feels now he's going to have to sell his home for 30 years. They are heartbroken. This one comes in from Marvin Silverman. Dear Glenn, actually got through the healthcare.gov website on October 5th, registered, got confirmation letter, PDF, enrollment in the Florida Blue Cross plan, and enrollment number. The letter told me I'd be hearing from Blue Cross in a few days regarding billing. I called Blue Cross of Florida. They have no record of receiving my application from healthcare.gov. I was told only 15 people in Florida were successful getting their applications to transmit to Blue Cross. They suggest I phone Affordable Health Care Office, which I did today. They told me my application was backed up, and the backup was lost. So the application for which I've written approval and a confirmation number is no longer in the computer system. They also said my application was not linked to my account. So the 800 number folks say they now linked it, but they can't tell whether I'm enrolled for a plan or not. I'm 64 years old. Next summer, I'll be eligible for Medicare anyway. The affordable health care enrollment is disappointing, to say the least. I think some high school computer whizzes could have done this better.
Oh, no, and a little bit cheaper, maybe than $400 million. I'm not sure, but I think maybe a tad under that, like $20,000.
Dear Glenn, I'm not sure if you'll read this, but this happened to be this weekend. We live in Dallas, Texas as well. I have a chronically ill son, 20 years old, chronically ill husband, and I'm a small business owner. We'd love to share our story with your viewers, but we have to get coverage of our family. It was a lovely weekend until I went out to the mailbox today, and to my amazement, we got a letter from our Blue Cross Blue Shield high-risk pool carrier that they are closing, and they are no longer going to cover our son, Isaiah, nor Michael, effective January 1st, 2014. So, tough crap to you people to find coverage. Go Obamacare.
What? I thought you couldn't be denied for pre-existing conditions.
No, they're closing down all of the
so they're just shutting down that.
They're just shutting down all the high-risk pools.
So that
which
way...
is exactly what we said would happen.
Yes. That's how they don't deal with the high-risk people, with the people with pre-existing conditions.
Do you know what you're going to do with countless other chronic illnesses Americans forcing us to go on to Obamacare? We were not able to afford your premiums. And Mr. President, you and your pitiful excuse of being a leader and your Congress and your Senate and you Republicans, you don't have to go on and care about all this because it's not good enough for you or your family. But I guess it's good enough for my family, us little people with chronically ill loved ones. You lied, Mr. President. You lied. You said if you had insurance coverage now, when this care becomes effective, you can keep your insurance. You're not going to be forced into Obamacare. That's a lie, Mr. President. You are forcing sick and chronically ill people into your excuse for care. I'm not even sure our providers and specialists and medications will take this care. We have already paid $1,300 a month in premiums for our son, Michael, and 30% on all of his medicines and all of his tests. We pay all of our doctors, good doctors. It's a major college loan. No one can understand this unless you have a chronically sick child or a family member. You have no idea. You don't walk in our shoes. You can do whatever you want. What is my family going to do? Let me tell you this. I have the best insurance that you can get for my company, and I don't know how much longer we can afford it. We're changing it to some degree. I'm not sure yet this year. And it breaks my heart because I have a daughter with cerebral palsy. And so I know how hard it is. I know what it's like to be not the guy at the top of the food chain, but the guy at the bottom of the food chain that has medical bills that you just can't afford. And so when I started this company, that was the first thing we did. From the very beginning, before we could afford it, all the way to now when we still can't afford it, we have paid for our employees the best medical care we could possibly afford. There's no deductible. There's no copay. We pay for it 100%. But I'm the rich guy that you're supposed to hate. Well, I'm the rich guy who has a daughter with cerebral palsy. My daughter was in the hospital last week. We're trying to make her seizures stop. As of right now, we can't make them stop. She had another one yesterday and one on the weekend and one on Friday before I got on the plane. I was playing cards with my daughter, and all of a sudden she just stopped and seized up, started having convulsions. Her hands were so tight, the cards were all bent in her hands, and I just stood up, and I stood behind her, and I just rubbed her back, and I knew she couldn't hear me, but I just kept telling her, it's going to be okay, honey. Before long, her hands opened up, and she resat. She was pale white. She didn't understand a word I said for about 5 minutes. 5 days before that, I was at the pharmacy with the best insurance money can buy. The doctor prescribed a medication for her, one of the 3 that she has to take. And one of those medications is $2,500 a month, and my insurance doesn't cover it. I stood at that counter, and I thought of you. How do you afford it? If you're a dad and they prescribe this medication and you don't even have my insurance and it's $500 a month, you're going through the same thing I am. I could say, fill it anyway. You can't. I stood at that counter for about 20 minutes. I went into that hospital pharmacy thinking about my daughter, and I spent the rest of the afternoon thinking about you. I think a year from now, definitely 2, most of Americans are going to be working part-time. There will be some IMF global tax that will add an extra 10% on everything. The people like me will be out of business. And the people that have done favors for this government will be in business. And they'll be fine. And we'll be the little worker bees. And they will test your children and train them from the very beginning to work for the corporation, be that Google, Microsoft, whatever it is. They'll spot them in Common Core. They'll spot them early, and they'll put them in special classes, and we'll all hope that they can work for a good corporation, that maybe they can have a job at a great corporation. But as the singularity approaches, you won't be able to afford some of the things that the rich people will be able to afford. Google, or I'm sorry, it wasn't Google, it's funded with Google money. I'm trying to remember the name of the company. I just told you the story last week. They've already patented. Just put a patent in for gene selection. So you'll be able to increase the intelligence of your kid and have everything that you need because you can actually pick the genes that you want. Of course, you won't be able to do that. You won't be able to afford it. But those at the top of the food chain, they'll also have the Google glasses, and they'll be able to, because of the singularity, according to Ray Kurzweil. This isn't science fiction. This is science fact. The London Times just ripped me apart saying, oh, Glenn Beck's afraid of the Terminator. No, I'm not afraid of the Terminator. Read The Singularity is Near by Ray Kurzweil. You pieces of garbage. You people in the press, open your damn eyes. See the future that is just on the horizon. Read Ray Kurzweil. The Singularity is Near. It's not a movie. It's real. And they're telling me right now, don't worry, Glenn. Everybody's going to be able to have the Google glasses. Everybody's going to be able to upload the information and enhance their intelligence. Really? How are you going to do that? Well, we're going to make it so cheap. Really? How are you going to do that? Just the same way we're doing it with Obamacare. That's how we're going to do it. Everybody will have it. It'll be fine. Everybody will have health insurance.